what normal period is, right? And you know that word, the problem when it comes to fertility, the word normal is actually very misleading. It's very misleading when it comes to fertility conversation. Why? Because people use it a lot, right? You hear things like my cycle is normal, my periods are normal, everything seems normal, right? But the truth is that normal in menstruation does not always mean optimal for fertility, right? And misunderstanding this singular word has caused many couples to delay their quests to seek help. They don't seek help. My message is normal, so I don't think I need help. You need help. Why? Because normal is not equal to optimal. Is that okay? Thank you very much, Ivy. I appreciate you. Right? So let's break this thing down clearly so that everybody, whether you are learned or not, you'll be able to understand what you're talking about. Everyday individual should be able to understand. And that's the essence of this live stream. The live stream is for everybody. Everybody should be able to learn something here. Right? Because majority of the people that are trying to conceive are suffering for nothing. Many of them is just knowledge that's a problem. Right? So what is a menstrual cycle? Let's start from there. A lot of questions we've been having. People say, oh, my cycle. So what is a menstrual cycle? And I'm going to be looking at this question from I'll look at it in a way that will help you understand what we're talking about, right? Because a menstrual cycle is counted from the first day of bleeding, that is day 1. So whenever the bleeding starts, that day is your day 1 of your cycle, right? And that continues, you keep on counting till the day before the next bleeding. So whatever you counted, that is your menstrual cycle. Is that okay? As simple as that. Now, this whole cycle thing is controlled by some good coordination of hormonal system that involve the brain, it involves the ovaries, it involves the uterus, right? Remember I said everything about reproduction starts here. Everything about knacking starts here, right? And by the way, that reminds me, in the month of June, starting from June 1st, we are going to have 30 days of what Christy LaBelle will call narcology, right? So we're going to be talking about sex, timing, and intimacy. So if you love knacking, come and learn something. And those who don't like, also come and learn so that you know how to knock. So that is in the month of June. Anyway, back to the gist. So the definition for what you call normal cycle is actually what the guideline that professional bodies have given us, like World Health Organization and every other organization, what they have given us. And they gave us that understanding on several headings, like cycle length, cycle regularity, cycle duration, flow pattern, right? So I'm going to be looking at them. I'm going to be looking at what a normal period is according to these headings. So who is ready? Let's start with the first one. Cycle length. So who's ready? Talk to me in the comment section. If you're ready, just type ready. Let me see the ready coming up. Good evening. If you're just joining, you're welcome. Tap on your screen, share the live, follow me, drop a heart me. And if you have a question, calm down. We'll answer your question when I'm done. Is that okay? So who is ready? Nobody's ready? That's good for me. Right? What is a normal cycle? According to what all the professional bodies plus WHO have given us, what is a normal cycle? I would want to start with the cycle length, right? A normal cycle is anywhere from 21 days cycle to 35 days cycle. So anywhere from those brackets, your own can fall in between. So that's what normal would be, right? Some people have 21 day cycle, some people have 22 days, 23 days, 24 days, 25 days, 26 days, 30 days, 31 days, 35 days. So that is what a normal cycle length would be, right? Then with respect to cycle regularity, what does that even mean? So when we ask you, is your cycle regular? This is the question we're asking you, right? So with respect to regularity, is the question will be, is it fairly consistent from month to month? Or there is variation of a few days? By the way, few days variation is acceptable anyway. So it came on the 24th last month. Now in this month it came on the 26th. That's fairly normal. Don't worry about that. Right? That is acceptable. So those small variation is acceptable. Right? So that's what what cycle regularity will mean. Right? Then with respect to duration of bleeding, bleeding should be anywhere from 2 days to 7 days. Anywhere from 2 days to 7 days. Please tap on your screen. Tap on your screen. It's very important. Right? What about flow pattern? Yeah? What about flow pattern? It should not be excessively heavy. Yeah? And not extremely light. So if it's in this range, it's good. Not excessively heavy and not extremely light. So if your experience fall within what I just said, you have a normal cycle. So what did I say? I want to say it again so that those who missed it, especially my friend that is cooking, because I'm coming to your house, we'll eat that food tonight. Right? So with respect to cycle, anywhere from 21 days to 35 days. With respect to cycle regularity, fairly consistent from month to month, right? And of course, few days variation is acceptable. Right? Few days variation is acceptable. Then with respect to bleeding, duration of bleeding, between 2 to 7 days. That's what normal will be. Right? Then flow pattern, it should not be excessively heavy, right? And not extremely light. Right? Oh, she's still here. Okay. I thought you're zapped. All right, you're here. Is that okay? So, at this point, many people think that if all these things we describe, say, oh yeah, you're describing me, then I'm so fine. But this is where the deeper understanding begins. All right? Because the reason why some of my friends are agitated, oh, I want to get pregnant, oh, I don't know what's wrong with me, oh, they told me this. The reason why they're agitated because of knowledge. If you have knowledge, you follow your fertility journey without hassle, right? No shaking, like we will say. Regardless of what they say, you maintain your composure and you are set on the goal. All right. Now, there are 4 phases of a normal cycle. Who's ready for this? There are 4 phases of a normal cycle. Because a truly normal cycle is not just about timing. It's not just about the time. It's about how well each of the phase function. That's what a truly normal cycle would mean. Is that okay? Now, the first phase in a normal cycle is the egg development phase, which you call the follicular phase, right? There was a time I did this an episode on the live stream, and I was talking about these phases with respect to women, how they interact socially. Very interesting, but I may never go back there. But the phase comes with different temperaments across the months, right? but that's not the gist tonight. So the follicular phase is the egg development phase. And now this begins on day 1 of the menstruation, right? So during this phase, what happens is that the follicles in the ovary, now this is your ovary, there are follicles in the ovary. So what happens is that the follicles at random will begin to develop due to the influence of hormones, right? Now, one of them will grow beyond others, and that means that one is more likely to ovulate. Is that okay? That's what they look for when they are doing your ultrasound scan during tracking. Is that okay? And this follicular phase can actually vary in length. It's not a fixed length. It can vary in length. So that is follicular phase. Then there is the ovulation period, right? That is where egg is released. Everybody wants to know about this ovulation. And because this is the most critical moment for fertility. If you miss this moment, you may just have to try next time, right? So a mature egg, remember the dominant follicle, right? For it to be dominant, it means that whatever is inside is maturing. So a mature egg will be released from this particular follicle that is bigger than others. So once it's released, that is the one that mature, right? And remember, after ovulation, the egg does not last forever, right? The egg does not last forever. After ovulation, the egg only lasts for 12 to 24 hours, right? Only 12 to 24 hours. So if you are knocking on after the egg has been released, you have limited time to even achieve success. More likely 0 success. If you are knocking after ovulation, 0 success. Why? Because without ovulation and timing it correctly, pregnancy cannot occur. So forget about pregnancy if ovulation does not take place. It means that no egg was available in the first place, right? Now, we move on from that phase, very critical phase, which is ovulation, then to the next phase, which is the luteal phase, right? Luteal phase is what you want to call the Is that Tulas? Hey, Tulas is here. Hello, Tulas. Good to see you. You're welcome. Right? So after the ovulation, then you have the post-ovulation phase, which is the time where you have support for whatever must have happened. Because the body expects that every time ovulation takes place, pregnancy should occur. Right? That's the expectation. That's the expectation of the body. Right? It's not the body's fault. It was designed that way. Was there ovulation? Yes. Therefore, I'm expecting a baby. So it begins to prepare. Right? So after ovulation, the body produces progesterone. Remember that hormone? Very important hormone, right? The body produces progesterone, and that progesterone is what now begins to influence the uterus to prepare for implantation. It prepares the thickening, the lining of the uterus. For some of you who have gone to fertility clinics, one of the things they are checking is the how thick your endometrium is. Very key. So when they check your progesterone levels, they are concerned about whether ovulation has taken place and you have enough preparation for implantation. A lot. So appreciate your doctor for the kind of things they've done for you. Right? Now, this particular phase is usually more stable and lasts 12 to 14 days. Right? This particular phase, 12 to 14 days. Now, beyond that phase, hi, sweet Dora. Good to see you. You're welcome. Welcome in. After that phase, then you have the menstrual phase. Menstrual phase is actually the phase of shedding, is more like a shedding phase, right? The shedding phase. Now, if pregnancy does not take place, the whole preparation that was done, hoping that pregnancy will occur, that whole preparation becomes frustrated. Why? Because we were supposed to get an implantation, but implantation did not happen. So what happens? The whole structure that has been built, waiting for implantation, begins to crumble. Why? Because hormonal levels is dropping. The hormonal levels are supposed to support that will build up, drops, then there's a collapse. Maya is here, right? So the uterine lining we shed, and that shedding of uterine lining is the menstrual bleeding that you see, right? And you see that month by month. For me, I think it's the body's way of expressing frustration that you refuse to knock so that baby will come. So when all that crumbles and menstruation happens, a new cycle begins, right? Now that we know the phases and what is expected, the question now is what makes a cycle truly fertile? What makes a cycle truly fertile? Right? Last month you got it twice. You were looking for it before, now it came twice. I hope you've seen your doctor. I want to know whether you are on some kind of medication or something like that. But I'm more interested in whether you are ovulating. Right? Is that okay? All right. So let's go back to the gist. So what makes a cycle? It's not enough to have cycle. So what makes it truly fertile? What makes it truly fertile? Okay, good. If you're ovulating, fine. So just knock waiting no good and produce babies for us, right? All right. Here is the distinction, right? A cycle A cycle can be normal in appearance, right? Look at all the things we've said. A cycle can be normal in appearance, but it can be suboptimal for fertility, right? Fertility, cycle, they are related, but they're not the same. Because a truly fertile cycle requires these things I'm going to mention. So if you don't have a pen and paper, I don't know what you'll be listening to. So what did I say? I said a truly fertile cycle requires these things I'm about to mention. So I'm trying to slow down so that if you don't have your pen and paper, you just grab it. Let me give you some time. Is that okay? So grab your pen and paper. Hey, Lady G is here. Hi, Lady G, good to see you. So are we ready now? We want to talk about what a truly fertile cycle requires. You have been having cycle back to back. Is it a fertile cycle? That is what I want to talk about. Thank you very much, Lady G. Who is ready? Talk to me in the comment section. If you're ready, talk to me in the comment section. Just type ready. And please tap on your screen. We should hit 20K. We should hit 20K. I'm going to collect my knowledge back. Oh boy, Francisca, good to see you. You're welcome. And all of you that are not following me, why are you not following me? At least for the knowledge, you should follow me. No, don't follow me. Don't follow me. Go so that somebody would confuse you. Then you come back. All right, let's continue. We're going to talk about what a truly fertile cycle requires. Number one. Thank you for your follow, sweet Dora. Number one. Confirmed ovulation. That's number one. A truly fertile cycle requires confirmed ovulation. You see, when people come here to ask questions, they're saying some things. What do I keep on asking one question? Can you confirm to me you're ovulating? Can you confirm to me you're ovulating? Because it's not enough to have cycle. You've been having cycle from only God knows when you were 8 years old, whenever, right? But was that cycle a fertile cycle? You've never thought of it this way, but I'm telling you now. I'm telling you by June, a lot of people will test positive with pregnancy, I tell you. You see, ovulation must be confirmed. Why? Because you cannot afford to assume that you are ovulating. You cannot afford to assume. There's no assumption in this matter. I'm talking to those that are trying to conceive. So if you're not trying to conceive, you may just sit down and listen for knowledge. But for those who are trying to conceive, I'm talking to you. You cannot sit down and assume because you are seeing your period every day. Oh, sorry, every month. Sorry. Right. All right, Christy Labelle, please go and rest. Thank you. Right? You've got to confirm that there is ovulation. Right? Good. The second thing is Remember we're talking about what a truly fertile cycle requires. So the first one is confirmed ovulation. The second one is healthy egg development. Healthy egg development. Hi, Billy, I see you. The egg must be matured properly before release. That egg was released during ovulation does not necessarily mean that it was mature. So for some people there is that kind of case, but most ovulated eggs are matured eggs, right? So that is the second one. Healthy egg development. The third one, adequate luteal phase. Remember luteal phase, the support, the post-ovulation support, right? That's luteal phase, because the body is expecting that ovulation that happened, fertilization will take place. So the body is expecting that you will not go to no good when you had ovulation and fertilization should take place, right? Right? So you need an adequate, you are not ovulating. Anyway, you're supposed to be in my DM, so come to my DM. I didn't see something, just scroll, right? So adequate luteal phase. Progesterone must be sufficient to support implantation, right? Because of what I already said, that it has to do. Dr. Temi Tokbe is here. Hi, thank you. Thank you very much. I appreciate you. Thank you. Right. Right. So that's what what progesterone does. It's like the housekeeper that will try to make everything ready. If a baby is coming, we need the bed done. We need the wall painted. We need preparing the room for the implantation. So that phase must be adequate, right? That phase must be adequate. Progesterone must be sufficient, and these are the things that your doctor check. Some of you are not patient with your doctor, and the question is why? Why are you like this? Thank you very much, Dr. Temi Tokbe. Thank you. Be patient. Let them walk you through this thing. Do not be in a hurry, because fertility is not magic. And I tell those people, they'll say, "Oh, well, I'm looking for a baby and I want to be pregnant next month." Sorry, not here, because we don't do magic. This is biology, and biology comes with precision and timing. Otherwise, you will be taken advantage of, and you spend more than enough money, and you'll be surprised why after all this money you've not gotten any results. You'll be shocked what's going on, right? So you want to be patient. And I've already told you, if you're not here before, if you are going to start having kids, learn to prepare your body 3 to 6 months. If you want to be successful, your body needs to be prepared. Man and woman equally, right? Because it's not just a female thing. Remember we did 30 days of male infertility, and we've now taught all the men how to produce precious sperm, right? Patients are not patient at all. Those guys, they are not patient at all, and yet we call them patients. Oh boy. How did we get that name for them anyway? So that is the number 3 thing. Must have adequate luteal phase. That is the post-ovulation support. And part of the investigations that will be done is part of the things that the doctor, these are not the things you go to the clinic and they tell you. But because we have enough time in the live stream, I get to tell you, break it down. So because some of you, you're always agitated. And that leads to a lot of confusion. But I want to help you. Don't be agitated. Have positivity, so that when your doctor talk to you, you will say, "Oh, Dr. Gordon mentioned it before." Right? I'm just joining myself with you and your doctor as a team to help you get a result. Is that okay? The fourth requirement for a fertile cycle is proper hormonal balance. Proper hormonal balance. Estrogen and progesterone must rise and fall at the right time. All right? They must rise and fall at the right time. The fluctuations must be proper. And when something goes wrong, you begin to have some of the issues many of you are complaining about. Right? So I'm sure you are learning. Are you learning something? Just talk to me in the comment section. Just type learning if you're learning something. Talk to me in the comment section. Type learning. All right. Now let's look at the common misinterpretations of the word normal. Remember, we said a lot of things about normal cycle and all that. So let's look at the common interpretations. You know what people will say normal is, what they think normal is. All right, just a quick moment. I want to ask those of you who are listening to me, you're not following me yet. Why don't you want to follow me? And if you have not dropped a heart me, why are you like this? This information is worth more than one coin, and you still don't want to drop a heart me. Support the live stream so that we can reach many people, right? So do the right thing. Tap on your screen, share the live. God bless you. All right, where was I? I was going to talk about the common misinterpretation of that word normal when it comes to periods or cycle, right? Number one. Today you must write too. If you are not writing, you'll miss a lot. Number one. Regular timing people think that regular timing is equal to fertility success. Of course, we urge you to time regularly. We want you to time, but do not get stuck in that information, because the reality is that timing alone does not confirm ovulation or egg quality. We need egg to be ovulated, and we want that ovulated egg to have quality. That is the reality. So that you have regular timing, you know when your ovulation happens and all that. It's not a confirmation that everything will go all right. Is that okay? It's not equal to fertility. Number two, monthly bleeding is not equal to ovulation. Monthly bleeding, and this is where a lot of people are stuck, and they've wasted their time all these years. Say, I'm having monthly bleeding, my cycle looks okay, so they don't think they should go and see the doctor. They don't think they should be evaluated. Well, thank God you are here today, and I'm sure you are beginning to, tomorrow morning or whatever time is it in your country, you go and see your doctor right now. Is that okay? Monthly bleeding is not equal to ovulation, because bleeding can occur without ovulation. What did I say time and again? Confirm to me that you're ovulating. Those of you that come and ask questions, I say, confirm to me that you're ovulating, because that is the key, right? Tulas, thank you very much. I appreciate you for the gifts. Confirm to me that you're ovulating. All right. So that is number what now? Who is following me? Number what is that? I can't remember. The next one. The next one is, you know that there are people who think that they only have problem when they start feeling pain. that's misunderstanding of how your system works. They say no pain is equal to no problem. So don't worry, no need for the doctor now. Understand this. Some fertility issues occur without symptom. Which symptom will tell you about egg quality? Which symptom will tell you about an ovulation? Do you understand what I'm saying? I hope you're learning something tonight. If you miss me here, by the time we get into other things, you may not be able to catch up. Number 4 now. Yeah, this is number 4. Some have the misconception that long cycles are always normal. Long cycles are always normal. Listen, I just told us what a normal cycle duration should be. Cycles up to 35 days can still be normal, but may affect timing. Right? So when you put all that information from the beginning till now, then you'll be able to understand what I'm talking about. Now, before I become tired, because I'm already becoming tired, right? Before I become tired, finally, I still want to take 1 or 2 questions, but let me just, before I become tired, there are subtle abnormalities that can happen within a normal cycle. Yeah, there are subtle abnormalities that can happen within a. Thank you very much. I appreciate you. This woman wants twins, so we are going to give her twins. Tulas, are you ready for your twins? Are you ready for your twins? Christy Lavelle has gone, right? Okay, because she accused me that I'm giving some people twins and I'm not. All right. So where was I? You're ready. Good. But you must agree to knock waiting no good for that twins to come. Do you agree? If you agree, we will send the twins to you. Do you agree? Do you agree? Why she's not talking again? Okay, we are waiting for her answer. So let's talk about the subtle abnormalities that can happen within. Okay, good. She agreed. So make sure you knock waiting no good as I release these twins to you. Between now and the ending of July, collect your twins. Then do the things we ask you to do. You will be fine, right? Oma sets has collected it by faith. Yes, that's how to do it. All right, so I want to quickly talk about subtle problems that can happen within a normal cycle. That you have a normal cycle is not devoid of problems. There can be problems within a normal cycle, right? There could be the issue of a short luteal phase. Remember the luteal phase? If you forget anything I said tonight, don't forget about the luteal phase. Luteal phase is that phase after ovulation, right? Some people can have short luteal phase. And if the luteal phase is less than 10 days, implantation may be difficult. What does that mean? It means that it has less than 10 days to prepare for fertilization that has occurred. And if it's less than 10 days, it means that the wall development and thickening will not be rich enough for implantation. Right? That's the first thing. So luteal phase can be short. You say, oh God, let my luteal phase not be short. Amen. Amen. All right. Number two abnormalities that can happen within your normal cycle is delayed ovulation. Ovulation may occur late. And when ovulation occurs late, it actually reduces your fertile window. And of course, remember I told us one time, I'll still go back to that. I told us that ovulation can swing forward, backward, due to stress, sleep deprivation, and all that kind of things, right? Even within a normal cycle, ovulation can swing, right? But when it swings, it's actually going to amount to delayed ovulation, and it shortens your fertile window. Remember, fertile window is 5 days plus the day of ovulation. So now it has swung forward, it has reduced your timing. So your knacking timing may not be that efficient. Do you understand? And those of you who don't understand what knacking is, knacking means sex, right? So do not be confused. Within a normal cycle, there can also be hormonal fluctuations. Hormones may fall within even a normal range, but still it will not be optimal. Everything looks okay. Everything looks normal. But is it optimal? Adequate enough? So these are the things that can happen, right? Now, in the coming days, I'm going to be talking about PCOS. I'm going to be talking about endometriosis, because these are silent conditions that is affecting a lot of people in their TTC journey. And this can exist within a regular cycle. Is that possible? Yes. It can exist within a regular cycle. So you want to calm down. I'll get there. I'll talk about you. I'll find solution, right? But a quick one is that Akua Otiwa is here. Low progesterone will affect implantation now. So lunar dolls, it will. Right? So quickly, before we take one or two questions before I go, right? There is the role of age in the whole of these gists, right? So those of you 35 and above, there's a role of age. As age increases, egg quality declines. Do not be offended, but that is what it is, right? That is what it is. That's what I'm telling you. When is the time to start trying to conceive? It's today. When is the time to make up your mind for that IVF? It's today. As age increases, egg quality decreases. So I know that somebody's giving you something to take to make you have quality eggs. Can you reverse age with a drug or supplement? You gotta be smart with your life, And also, as age increases, hormonal patterns also may subtly shift. That's why you begin to wonder, this is my cycle. I need to understand them again like before, right? It's age, right? So even if your cycle remains regular, dog does not want us to sleep from them. Yeah, so better knock with no good. Right. So even if your cycle remains regular, the fertility potential may decrease because of age. Because of age. Don't play with that part of the gist. And as age continues to climb, your treatment options declines even further. And begin to wonder, what else are you not doing? Nobody's talking to you about the age. That's why for some people, the moment I hear that story, I just ask you, when are you going to do IVF? Because that may just be your way out. Even with the IVF, your chances are still slim. Right? Go and do pregnancy tests, Safinat. Go and do pregnancy tests. Then come and tell us how far. Now, this is the reason why understanding your cycle matters. This is the reason. Knowing your cycle helps you to be able to identify your fertile window. And that's the reason why I'm talking about this. Right? Because if you would know your cycle, you can understand when and where your fertile window is. It also will help you recognize irregularities early. What is irregular? What is shifting? It helps you seek help at the right time. And I am telling you, some of you, you're beginning to understand that you need to go and seek help now because you're listening to me. Now is the time. Don't wait. Stop waiting. Right? Why are you not conceiving? That's why I'm here to answer that question, Sarah. Right? So if you have not followed me yet, you want to follow me. Guys, let's take these likes up to 30K. Let's take the likes up to 30K. Look at the amount of people. Between January and now, we have 13 people just by listening who are tested positive to pregnancy. Right? It's more than that, but I know the backstory of everybody, so I will leave it at 30. Right? 7 more before June. So when are you going to put your name in that target? Right? So when you know your cycle, it helps you seek help on time. It will help you transform guessing into informed action. And that's what this live stream is all about. Fertility is not guesswork. It's precision. It's timing. It's biology. So when I tell you to follow me, I'm not telling you to follow me because I want you to be looking at my nose, right? Follow me because I want to help you with timing, precision, and biology, right? So how do you know? How do you know if your cycle is truly healthy? Aha! If you stopped writing before, you need to go and grab your pen again. Right? How do you know? I think this one is for Tulas. Tulas, this is for you. Based on what you asked earlier. Ololade, just keep listening to me. The answers are in the things I'm saying, right? So how do you know if your cycle is truly, truly, truly healthy? Is this cycle healthy? This one that I'm going into now, is it healthy? Talk to me. Just type ready in the comment section. Type ready if you're ready to hear this. If you're ready to hear this, talk to me. How do you know if your cycle is truly healthy? I'm just thinking about, when we started this whole live stream, I said to them that time, I said that the challenges majority of people that try to conceive have is ignorance. Not that they have one kind of disease or something. People were thinking about, what is he talking about? I've been trying for 5 years. What do you mean? Even with the 5 years, the problem is knowledge. And a lot of homes have torn apart because of infertility. Yet it's still ignorance. I will cure your ignorance, right? So don't pack your bags yet. Is that okay? Don't pack your bags yet. Tap on your screen. We need to hit 30K, right? So how do you know your cycle is truly, truly healthy? The first thing, he said, please cure my ignorance. All right. So the first thing, track your cycle. Track your cycle, right? When I tell you I want to work with you in this journey of fertility, I'm not just going to tell you, go and take this drug and leave you alone. No. Every step of the way, I've got something to tell you. So it's either you are following me or you divert. A lot of people have diverted. They go look for herbs where they go drink. They say your own is too slow, right? Continue. So track your cycle. Track your cycle. You need to monitor the length of your cycle, consistency of your cycle, and the symptoms. Write it down so that you don't forget. If you forget, go to YouTube. By the day after tomorrow, this live stream will be on YouTube. If you miss it, you will pay from your nose to just to get the result. Nobody will teach you this. Nobody will teach you. But you will pay from your nose just to achieve this thing. Track your cycle. In the tracking of your cycle, these are the things you monitor. You monitor the length. So the next time when I ask you, what's the length of your cycle? You don't say This is what you track your cycle, monitor the length, monitor the consistency, monitor the symptoms. Right? That's number one. Number two, confirm ovulation. How? Somebody asked that question tonight. Say, how? How do I know I'm ovulating? A few ways. I'll just give an idea. I think I've done that before, but I'll just give an idea for today's sake, right? So you can confirm ovulation through, some people use OPKs, right? Ovulation prediction kits, right? Now, it helps you confirm that you are ovulating. But if you are trying to conceive and you want to hit the mark, right? You want to know that you're actually meeting before the ovulation. But this one will confirm that you ovulated. most times, by the time it shows you that sign, the ovulation had already happened, right? So some of you using that OPKs, you're actually knocking after. You don't see the ovulation. Let me go and knock. Nah, it just told you that ovulation has happened, right? So that's why you don't use it alone. OPKs, you don't use it alone. Use other parameters plus the OPK. Is that okay? Francisca, that question is too high for me. You want to remove fibroid from your uterus without, if the fibroid is small, don't worry about it. It's all about size and location. If it is not in a location where it affects pregnancy, don't worry about it. If it's small, still don't worry about it. Right? Stop this agitation. Go and find out again the location and the size. Then come back and I'll tell you what to do. Is that okay? I can't remember who asked that question, but you know yourself. So confirm ovulation through OPKs, ovulation prediction kits, ultrasound tracking, right? Folliculometry. They'll track the progress of your, and I can tell you in 24 hours you're going to ovulate. So that's a good way to track. And also through progesterone testing, right? So you want to be smart. There's also the cervical mucus part of the gist, right? But for tonight, just hold this one. Is that okay? So that is number what I've mentioned now. I don't know what number, but the next thing is you want to observe your body signs, which also will include the cervical mucus, right? Your body signs, like the changes of cervical mucus. Remember that every phase of your cycle, the cervical mucus also change, and the consistency varies, right? So when you see the consistency changing to egg white stretchy consistency, it means that ovulation is nigh. Right? Ovulation is nigh. So just the knack waiting no good. Just the go, right? Please, let's keep taking the likes up. Let us hit 30K. Right? You can also use basal body temperature. But again, you must be meticulous, right? Take your body temperature in the morning. You have to be meticulous on that one, which many of you I cannot even guarantee that for you. But it's one of the ways. It's one of the ways you can use under observing your body signals, right? So, guys, I don't tire, but long story short, if pregnancy is delayed despite regular cycle, right, it means now that it is necessary for you to be evaluated. Get evaluated. Go for investigations, right? Go for investigations. Go for investigations. And don't always think that fertility can only occur in a cycle that is shorter or longer than 28. There's no such like a perfect 28-day cycle. You don't need that textbook knowledge. I just told you the range, right? So I hope you've learned something tonight. If you didn't learn, don't worry, you'll go and pay for it. But if you learn, God bless you, and I see you in the month of June with a tested, after testing, positive to pregnancy. Is that okay?